Good afternoon, and thank you for joining us for this episode of Living Well with Adena. As you know, we start off with our COVID vaccine update with our Chief Pharmacist, Fred Yingling. So Fred, I think you have some new news for us this week.
Yeah, thanks, Dr. Gabus. Just real quick, just want to update everyone on our numbers. Here at Adena, we're up to 19,730 patients we have administered at least one COVID vaccine to. For the county, Ross County is at 33% of the population has received at least one dose, and for the state of Ohio, we're up to about 39%. So we were keeping up with the state. We're kind of, not only Ross County, but the Southern Ohio, we are kind of losing some ground and keeping up with people still getting out to get vaccinated. But yeah, as Dr. Gabus alluded to, the pause for the Johnson & Johnson vaccine has been lifted. We have been given the go-ahead by the CDC and FDA and Governor DeWine to resume administering the vaccine. And we're actually having clinic today at the Packard Medical Center here on our Chillicothe campus. We still have plenty of spots. If anyone needs or wants to come in, we'll be here till 3 o'clock today. Come on in. If you can sign up at the Get the Shot ahead of time, that would be great. But we do have openings today. As mentioned, it's a good thing that after the CDC had a chance to look at the occurrences, found that, really wasn't a whole lot more of occurrences than what we normally see. Having said that, there has been, if you do come into clinic or you receive a Johnson & Johnson vaccine, they have updated information on the patient fact sheet or the information that we give you about the vaccine. And it lists what to look for if you were having one of these rare occurrences of a blood clot and that kind of thing. Mostly what they've seen is the demographic are women aged 50 and younger. So overall, still very safe. I'd have no reservations, with anyone getting any of the three vaccines. So that's where we are. I just wanted to mention, since we have resumed with the J&J, next week we will be running full day clinics on Tuesday, Wednesday, and Thursday from 8 a.m. to 4 p.m. here at the Packard Medical Center in Chillicothe. You can go to the Get the Shot website or visit our website at adena.org to get the latest. I would say we're probably entering a phase here. I would say it's like a phase 3, with phase 1 being a vaccination of the healthcare workers, 2 being the public. I think 3, hopefully you will see us, all providers, moving to getting these vaccines in areas or healthcare environments that people are more used to receiving vaccines. So there's more to come with that. So always you can check back to adena.org and we will post those types of notifications as things change in the future. But that's all I have to share today. Thanks, Dr. Gabus.
You're welcome, Fred, and thanks to the National Guard for staffing our mass vaccination program here at Adena. Remember,
Absolutely.
You can register at gettheshot.coronavirusohio. We're coming into a time where most people who are going to get the vaccine right away have already taken advantage of that. So thanks, Fred, for organizing that and the staff that you have working to keep our vaccination site open. Thank you very much. Over the last 6 years, I've been privileged to be the chair and the president of the Hope Partnership Project. And the Hope Partnership Project is a multi-agency, regional and state level coalition to help fight substance use disorder. And over that time, I was also functioning as the Ross County coroner. And that's been a tremendous eye-opening experience with the number of people who suffer from opioid use disorder, which is part of substance use disorder. And we're going to talk today about that. We have 60 community partners in the Hope Partnership Project and 150 individual members who work tirelessly to help our community reach a point where opioid overdose death rates decrease. So what is SUD? SUD stands for substance use disorder. It's a disease that affects the person's brain and behavior, and it leads to an inability to control the use of a legal or an illegal drug, whether that's alcohol, methamphetamine, fentanyl, cocaine. And alcohol is still the most common drug of abuse, but in our region, opioid overdose deaths have made opioids a key player in the causes of those overdoses. In 2019, nearly 50,000 people in the United States died from opioid-involved overdoses. So the misuse of and addiction to opioids is a major issue. Prescription painkillers, heroin, fentanyl, all of those are in the same class as hydrocodone and oxycodone. So this is a serious issue in our region and a serious issue in our community. So today we're going to focus on substance use disorder. And today we have Dr. Ezekiel Hernandez, who's from Adena Family Medicine of Washington Courthouse, Chief Ron Myers, Chief of the Chillicothe City Police Department, and Captain Michael Short, also with the Chillicothe Police Department. Thank you so much for being here.
Thanks for having me.
So, Dr. Hernandez, welcome, and could you give us a little bit of history as to how you came to the area, to Washington Courthouse, and what's your interest in treating substance use disorder?
So I came to Washington Courthouse over in Ohio from Pennsylvania. I was working in Reading, Pennsylvania, and I got introduced to substance use disorder because I was working at a small clinic in downtown Reading, Pennsylvania, where the need for something to be done about opiate addiction and overdoses was there. So one of my coworkers or other participating providers said, let's get educated about this. Let's start a program. Let's get other providers involved and see what we can do here in Reading. From that, we went from having one clinic to having 4 clinics, and I saw the impact of like addressing it more as a disease instead of a crime or an issue that law enforcement had to be involved in directly. With that, it opened my eyes as a clinician, as a provider, to the disease state of it, the knowledge of it. And then from that, I saw Adena as an opportunity to go from 4 clinics to a system, a health system, to try to affect Southern Ohio, Kentucky, West Virginia area, being that this is a concentration of the issue. With that, I was hoping also to get into using grants or using support from NIH and government funding to say that how we can best affect this, if we can come up with better protocols and see like if even genetics testing or new technologies could be used to kind of provide better care. As I've been here at Adena, I've been able to work with the HOPE partnership and work with the addiction committee in coming up with a way for primary care to address the issue within a routine office visit. So patients can come to their primary care office and talk to their doctor, say that they have the issue, and we can start having the conversation about how this is a disease of the brain and how the issue can be addressed with medications and properly addressed with services within the community. Additional to that, I've done some more investigation on the side of like it being a brain disease and how we can even use new technologies with genetics testings to kind of identify who would be more at risk. In that, I've gotten the chance to work with some great people here with the HOPE partnership, also including yourself, encountering you and everything that you've done for the community so far. So that's where I fit in.
Okay. Well, thank you, Dr. Hernandez.
Yeah.
Thanks for giving us that journey that brought you to Ohio.
Yeah.
So let's start at the beginning. What starts substance use disorder? Is it always there, and just if you are exposed to a substance, it's automatically there? How does that start?
So I just had the conversation this morning with a concerned parent. She's in her 60s. She was talking about her daughter and granddaughter, and she was describing how her granddaughter had just recently come out of a recovery system for her his history with the disease of addiction, and her granddaughter. And again, for words matter in this case, where how you describe the person afflicted by the disease. Like, remember, they're a person, and they're a person that's been affected by a disease. Just like if it was Parkinson's, you still remember that the person is first and then the disease, right? So she was talking about her granddaughter and how she came out of recovery, and how she's hoping that her granddaughter can stay clean. And again, the use of clean is more like in recovery would be better said in that statement. And I explained that this was a brain disease, that we've come a long way from understanding it to be a war against drugs to being a public health care crisis, and that there's been even studies that show imaging, brain imaging, that shows that there's certain parts of the brain that are activated during this brain disease, and that there's medications that can treat it. So if you come to me and you say that you're having some tremor or shaking fits, and we're talking about Parkinson's, I'm going to give you Parkinson's medicine to treat your disease, and we're going to get you better, right? The same with this of addiction. If you're saying that you may have a substance use disorder, I'm going to give you medicines to treat your substance use disorder, and we're going to hope that the person stays well with their disease.
So let's take your example where you saw a grandmother who was worried about her granddaughter. What would be a typical scenario of a person who say had an accident or sprained their ankle and received a prescription of narcotic pain medicine? How does that go from treating pain to being dependent on a substance?
So for the example, like during my intake of a new patient that's coming in for whether it was chronic pain or whether they're coming in to look for medication for treatment of substance use disorder, I always ask, was this recreational, or was this something that was after an accident, procedure, that you were first exposed to a certain substance? And how did that turn into this of misuse, and how you progressed? And then a lot of times I hear the story of motor vehicle accident or procedure for back pain, et cetera, that led to, or even a dental procedure that led to prescribed medications for pain that became used for pain, but then became misuse. And it kind of traveled on that course. Now, with some of the research and like looking around to see like how to better ascribe the diagnosis of opiate use disorder or substance use disorder, we do have opiate use disorder or risk scales that we can use for certain persons. And this is not to say that this is purely, it's untouched by social determinants. So it's a brain disease, but if you are around the element of poverty, violence, substance users, or other individuals that are abusing or misusing substances, it increases your risk of developing this condition because you're in the environment or social, or if you have issues with depression and anxiety that have not been addressed, it can increase your risk of developing this issue, this brain disease. So I do screenings for depression, anxiety, opiate risk scales. In the opiate risk scales, they ask questions personally. Have you had an issue with substances before? Has your family had issues with substances before, including alcohol? And then also if there was any type of abuse in the past. And if you score high on the scale, you're at risk for becoming, having an opiate use disorder. So in that, we talk about that, and then we try to see if with Suboxone or other medications for treatment of the substance use disorder, that we can choose a medication that's been FDA regulated or approved for substance use disorder and take them away from other substances or illicit substances that could drive them down to overdose or other issues.
One of the things that in my experience as a family physician and as coroner and as a community member involved with the Hope Partnership Project, trauma is, if there's a common denominator here, it's trauma of some sort. Physical trauma would lead to the prescription of pain medicine, but it's the emotional trauma really that some people medicate. So I've had people tell me after they've misused opiates, they say they actually feel normal. And this is the first time in their life that they've ever experienced that feeling of being normal. And when they describe it like that, I would think to myself, wow, if that works, why wouldn't I keep using it if it makes me feel normal? But that just illustrates the lack of coping mechanisms for these people to go back and address their trauma. And the trauma may have been decades ago, but the pain is still there.
Mhm.
So I know I've had lots of family members say, what can I do to prevent this? What can I do to recognize the signs early? So what are some of the unhealthy drug use signs or signs of physical dependency on substances?
Usually when we're talking about like the substance, so identifying if the substance is prescribed or found elsewhere on the street or whatnot, usually for dependency or tolerance of the medication, you see an increase in the need of the dosing or an increase in the need of the frequency where they're using the medicine. And also there's a disconnect between using it for treatment of pain or for emotional distress and just as a necessary for them to feel what, quote unquote, you said, normal. So there's a detachment of like having pain and then taking the medicine to needing to take it just to feel normal as it goes. And it's almost, they forget that the pain was there, but it's more like, I just need to take it so that I feel normal.
Mhm.
And that's where it crosses from, using it for the cause of pain or emotion to using it because the body is now dependent on it. They've become tolerant to it,
Mhm.
and they've crossed that line. So that's for red flags, increase in dosing, increase in frequency. It's unattached to like pain or emotional distress.
Mhm. One of the things that I've noticed with illicit drug use is there tends to be a change in behavior where somebody who is talkative and conversant, now they become a little more isolated or withdrawn. Their behaviors aren't consistent with who they are, and oftentimes parents will say, "I'm not sure what's going on with my son, my daughter, my granddaughter, my grandson." And how would somebody get an assessment of their family member for unsafe use of medicines?
So, and I think we were talking about this yesterday about stigma,
Mhm.
and talking about stigma, how we define stigma of this issue of the disease of addiction. A lot of families have a undue fear, shame, or pain or discomfort due to the history of addiction within their family or friend. And it's hard for them to talk about it and bring it to the light of a professional or provider, because then it's like they have to accept or relive the fact that their loved one just experienced this or their friend is part of this lifestyle. And it's the stigma in thinking about it as whether it's the family member or the person that they're trying to, like, they have to live through the stigma and see it as like it's not because it's something that they're doing purposely or they're trying to hurt the individual or hurt you, and it's more of like seeing to undo the stigma and say, okay, this is a disease state. If they were a diabetic and uncontrolled, I would take them to the doctor. If they had uncontrolled blood pressure or they were telling me they had chest pain, I would take them to the doctor. But the symptoms that they're showing me is that they're coming short with their money. They're always needing some gas money. They're always saying that they're feeling sick, they don't want to go out. They're always up all night, sleeping all day, or behaviors changing and they're short. So their temperance changes. And then the idea of the addiction being the issue and the stigma with that, whether it's pain, whether it's shame, whether like they have to undo themselves of the stigma and then step forward to say, I think we need to take you to the doctor and talk about what could be happening with
Yeah.
this addiction.
Yeah, we have such an acceptance of. So, Chief Myers, if you had high blood pressure, you'd say, "Of course, I want to take a medicine for high blood pressure. I don't want to have a stroke or a heart attack." Or Captain Short, if you have arthritis and you need medicine to help keep you at work, of course you're going to do that. So, what are some of the medications that might be available for somebody with opioid use disorder, and why do we seemingly substitute one substance for another?
So, of the medications that we have, more traditional or that's been used more traditionally in history, we've had methadone. We've had now Suboxone and Subutex. We've had, and then Vivitrol are some of the medications that are traditionally used in this of substance abuse. Vivitrol is something that is used for individuals that also may have an addiction to alcohol. So persons that have issues with alcohol use or abuse, Vivitrol can be used for, and that might be the initial conversation. I think you may have one too many drinks when you go out on the weekend, and let's go talk to the doctor about this, and then you may introduce this first medication for an addiction issue that the patient may be having or the person may be having at that time, and then they may be introduced to Vivitrol. And then after that, if there is an opiate or a substance use issue with other medications that may be a morphine derivative, then we have Suboxone, Subutex, Sublocade that we can use for that. Now, these medicines, the way they work is that they potentiate or touch the same receptor that this narcotic touches, but they do it in a partial way, and they do it in a way that doesn't put the patient at risk of overdosing the same way as this other narcotic could be doing. And it's the reason that this is it's a better approach to whatever they're doing on their own is because they're being metered, they're being followed by a professional, a medical professional. We're connecting them with services. And then what we're trying to do is that to introduce the medication to help the addiction and then titrate them off if we can titrate them off on that system.
Okay.
And it's monitored. So,
okay, great. So I know that lives have been regained.
Yes.
Because of the use of medication-assisted treatment.
Yes. I have a great. I just saw her the other day with her baby. So she had came to me after being identified through OB-GYN, and she was in the throes of addiction during her pregnancy. She got switched onto Subutex during pregnancy because Subutex is safer for the pregnancy. And then after delivery was connected to me as an outpatient to continue with her care on Subutex and also monitor her for that. She wasn't going to make it as a pregnant single mom, but she did. And the child is beautiful. I just saw it the other day. He's there. He's just got to a year. He just made it there. And mom is doing great. She's getting her license back. She's getting a car. She's trying to work. She's a person. She's a person that's a mother that has a newborn child. This is the fourth child, but she's getting her act together. And she's showing up at the appointments. She would ride her bike to the office to get the next appointment. She would walk there if she had to. Okay, so it saved her, and now the child has a mother. To continue.
All right. Well, thank you.
Yeah.
Thank you. One of the things that we want to be sure about is if you're watching this and you think, well, maybe I have substance use disorder, or somebody that I know and love or live with or is in my life, what can you do for yourself or your family members to hook up with resources that will help? You can call 211, which is our local agency referral phone number, kind of like 911. This is 211 for information. And they have a whole list of services that are available. Also, the Ross County Community Action Center has a center at their headquarters at the corner of Woodbridge and Western Avenue, where they have peer supporters and they have people who they can refer you to for treatment. So that phone number is 740-702-7222 for the Ross County Community Action. So just starting is a key component to this. And now we're going to take a little pivot here and bring in our law enforcement colleagues. Chief Myers, why don't you give us a little bit of an introduction about yourself and your service to the city?
I'm Ron Myers. I'm the current chief of police for the city of Chillicothe. Been on the job for about 25 years. Majority of my career has been community-oriented, policing-focused, problem-solving. And as we're talking about post-overdose response, treatment, And addiction has kind of fallen into my career of these 25 years in dealing with these things. I'm an advocate of treatment and recovery, mental health, and other societal issues such as homelessness.
Okay, thank you. And Captain Short, how about introducing us to you?
Yes, Captain Short, born and raised in Chillicothe, started in 2009 with the Chillicothe Police Department, regular road patrol officer, worked my way up to becoming a canine officer. Then I was promoted to sergeant. I was over second shift a little bit, then third shift. And then this year I got promoted to captain in January. Since January, yeah, thank you. Since January, I've been more working towards the areas of community policing, working with substance abuse, addiction, trying to hit them areas in our area and what we do in law enforcement in our area.
Okay, well, thank you, and thank you so much for being here. And we'll touch on some things that law enforcement agencies are doing here locally that are a critical piece of our community's response to the opioid epidemic. And as we in our region know, the epidemic is real. We probably have somebody that we know personally that is affected by this, and we may even know somebody who died from an overdose. But it's happening right here in our communities. And over 4,000 Ohioans died of a drug overdose in 2019. In 2020, in Ross County, the number of overdose deaths were 56. That's the highest in recorded history during this opioid epidemic. The previous high was 44. So during COVID and with isolation, I imagine that was a component of that. So Captain Short, what are some of the initiatives that were developed as a response to these fatal overdoses that the Chillicothe Police Department is involved in?
Yes, the Chillicothe Police Department over the last several years since the heroin epidemic and these overdoses started has been working on a referral type system. We've had officers in that position where we take people to rehab that need help. These officers are on calls, they're on scenes. This officer in particular actually would drive people to Cleveland if needed or Toledo. Since then, that officer has retired, but we have replaced him with a social worker that now works for the Chillicothe Police Department through a grant, Joanna Adena. She's doing a wonderful job. The officer is able to reach out to her, send referrals. Joanna actually does ride-alongs, goes on calls, has been on a few overdoses herself, and she's able to make that connection with help, with getting these people the actual treatment they need instead of jail. We're trying to not take them to jail, try to get them the help they need so that they can start on that road to recovery. With that process, the chief and Officer Bud Lytle and Deputy Dave Weber and Deputy Emily Smith started the PORT team, Post Overdose Response Team. This back when they first started, this was a groundbreaking program that we had law enforcement, we had peer supporters, we had addiction agencies, we had service providers going out and responding to the houses where people overdose, to the drug houses, to the houses that were the problem houses, and making contact with these people and giving them and offering help. And that was probably one of the best programs we've done in the last 4 or 5 years.
Okay, and thank you for doing that. I imagine it's kind of funny not funny, humorous funny, but curious that a policeman or a sheriff's deputy are coming to my house. Why do I want to let them in?
Yeah, it's a great point. So we have to overcome that in the beginning sometimes. Hey, I'm Michael Short with the police department. I'm a captain. I'm not in uniform. I'm just in my polo. We're taking that away. I'm here to help. You're surprised. The people were surprised at first. Hey, you're not in any trouble. We're not checking you for warrants. We're not even, talking to you about anything law enforcement related. We're here to help. We care. We care about you. And then, sometimes, they look at you and they start opening up. Then I introduce them to our team, and I kind of take a step back and let them, do what they're trained to do and what they're really good at. And our peer supporters and our social workers in this area are really, really good at communicating and getting people help.
Okay, thank you. Chief Myers, how does the team follow up with somebody who's had a port visit? If they've overdosed and they've had a visit and have had resources provided for them, what if any follow-up is there?
Sometimes it's kind of difficult to follow up because we have a large transient population. But that's where like our social worker, Joanna, comes into play, and our peer supporters come into play. They try to get telephone numbers. One of the biggest tools that they've had recently is Facebook.
Mm-hmm.
So they're reaching out via Facebook to check on folks that we've visited through port. And the other thing is just follow up with the family members, to find out, if they've gotten into treatment or recovery, where they're at, so we can get them additional services.
Mm-hmm. So I know that whenever you go, oftentimes people may not be home, or when you go, you want to be sure that you're leaving resources for the families or for the person who is affected by opioid use disorder. I see that you have a bag with you. What's in that bag for port?
Yes, so we do. We leave a port bag. We try to leave it with the actual person who overdosed recently. Sometimes we have to leave it with family. Sometimes, worst case scenario, we got hang it on the door and leave it and hope that, they get it. The port bag is a bag that contains a lot of information. It has brochures for different treatment facilities. It has information on, where you can get meals, who you can follow up, what addiction services maybe you need, homeless services, support groups. We'll go in here and we'll open it up real quick. It's just something to get to these people to start the process to get them to Dr. Hernandez or get them to someone. So we have the Hope Clinic brochure. We got the 201 brochure where they can call for help and get resources, because we're running to these houses and making contact, but we're realizing that it's not just addiction. It's family issues. It's homelessness, food. They don't even have food. We went to one the other day and it had no electric, no water. And it was just a terrible scene. We were actually able to, get them to community action and get them some help and find housing. So that's in here too. There's cards to our social workers. There's a meeting list for AA meetings, NA meetings. There's actually, some lists on COVID information. Free masks are available. Our social workers cards in there. Peer support cards in there. And once we get to these houses, we realize, I think it was said earlier, that there's trauma that is larger than the addiction. There's actual physical trauma. We see domestic issues where, a spouse, will open the door a little bit and look at me, but then I can see someone in the background kind of like, hey, don't talk to him, close the door. So we have to break the barrier when we first get there. Hey, we're here to help. And we have to really, I could show up and say, hey, I'm here to care. I care about you. I'm here to help you. But they could tell if I mean it or not. These people are intelligent. They're humans. They're people. They're very smart. You have to care.
Yeah.
So
thank you for caring. Thank you very much for caring. Chief Myers, whenever one of your officers detains somebody who seems to be under the influence of a substance, what are their options? I know they can be arrested for different violations. That's one option, to get them into jail, and the jail typically, that they're not going to be exposed to other drugs. What are some of the options that your officers have when somebody is detained?
Well, we're not going to arrest our way out of this problem. That's plain and simple. So that's why we're taking that approach of treatment and recovery, but there has to be some enforcement to it too. So if we actually send somebody, or we charge someone, we have options for drug court. If you complete a program, you get certificate. It builds you up. That court mandates that you go into certain treatment and going to go see the doctor and do things like that. But to keep people out of treatment, that's the last we want to do, is send somebody to jail if we don't have to. But that's where our social worker and our peers come in to play. Mm-hmm. And there's other entities out there that will help us while we're in the field. And sometimes it's 2:00 in the morning and somebody wants to go to treatment. How do you deal with that? Mm-hmm. So sometimes we can make the phone call, and if we can get transportation, we can get people into treatment almost, not instantaneously. It may take a few hours, or it may take the next day. But that's one of the things that we really pride ourselves on, is that collaboration and community network that we have to get people into treatment as quickly as possible.
So we've talked about kind of the darker side of substance use disorder and interactions with law enforcement. And we heard a success story from Dr. Hernandez about his patient who was a mother who still had her baby in her custody, which is a plus, and she's back in society, being a community member. What are some success stories that you know of that give us hope?
I was just driving down the road the other day, and a young man pulls up to me and says, "Hey, Officer Myers, I'm doing great. I've been clean for 6 months." And just for somebody just to stop you on the side of the road to yell that to you, and I couldn't tell what the young man's name was, but just that he knew who I was, and that apparently I'd reached out to him, or he knew who I was in the community, for him to stop me and tell me that he was doing good. That's worth
That's great.
all there is that you can do.
It gives you hope that
Yeah.
what you're doing is actually making a difference
Yes.
too. Captain Short, how about you?
Yeah, just the other day I ran into a girl I went to high school with, and I struggled when I first started. When I was seeing people that I grew up with were struggling with addiction, and I think one of you guys talked earlier about they're a different person. Why is my kid a different person? Why is this person I know not acting the same? And it's one of the first questions I ask. I'll go to the parent, loved one. I'll be like, "Hey, do they usually act like this? Is this who they are?" And they're not. I ran into this girl I went to high school with. She goes, "I've been 21 months clean." And I looked at her, and I could instantly tell she's clean. I could see it in her face, in her eyes, her body language, and that's all I needed. That is what we want in law enforcement. We want to run into these cases where they're clean. We want to be out there and seeing people working now, having kids, being with their kids, being a parent, just living life, having a life, loving life. Addiction, in my mind, and what I've seen from my experience is these people just struggle to get through life every day, and it's so hard. And once they get clean, and they're in that recovery forever. I mean, they have to fight this every day. But now they're in life, they're loving life, they're living life, and that's what we like to see in law enforcement. We don't want to deal with the same person over and over again, and it's great to see a success story. Yeah.
Okay, I know that the some of the data that I've read for prevention, and one of the key components of that is parents talking to their children. What are some of those conversations, or at least maybe some icebreakers that a parent could use to open that conversation with your kids?
And you said this earlier, stigma is the biggest thing. And until we break that stigma, especially on a family basis, then there's no conversation you're going to have with your children. So you just have to be point blank blunt and break the stigma with your children. Hey, here's what's going to happen. Here's your choices, and if you're going to do this, we're going to help you out. Well, we don't want to, but if for prevention wise, there's Denial, Ohio. It's kind of that was going pretty good for a while. You have to realize that there could be a problem, and if you sugarcoat it to your kids, they're not going to believe it. So you just have to be blunt and to the point with them. This could happen. Here's what's going to happen if you do it. Type of thing. So yeah, you shouldn't sugarcoat it. Just and that stigma is a big thing. So parents are in denial.
Yeah, the from my experience, and just like the chief said, it all starts when they're young, and the parents being a good role model. Be a good role model for your kid first. Kids are so smart, and they know so much, and they see so much. They know when mommy and daddy's going to the bathroom, not coming back, and they're acting different. They know that. They see it. Be a good role model first. Be there for your kid. When they start getting older, have that conversation. Like the chief said, you gotta have the conversation. You gotta say, hey, not just drugs are bad, but hey, you're gonna be offered this, and in your life, stuff's gonna happen. You're gonna be down, and you're gonna need help. Ask for help. Communicate with me. That's another thing. Have a great open line of communication with your kids. Don't teach your kids not to communicate. To communicate with their teachers, communicate with their principal, communicate with someone, communicate with me, law enforcement. The best program I think out there is school resource officers and DARE officers. From my point of view in law enforcement, we're able to touch these kids at a young age, tell them, hey, we're here for you, we care, we're not the bad guy, we're here to help you, and give them good information, and they can reach out to that officer. We've had it happen.
Mm-hmm. All right. Well, thank you, Captain Short, Chief Myers, and Dr. Hernandez. I know that law enforcement in this day and age in our country has a lot of scrutiny applied to their actions. If we were to apply the same scrutiny to the successes that you've had with changing the mindset of law enforcement to be a help for people who suffer from substance use disorder, I can say from my heart, law enforcement is one of our strongest partners in this fight. And I can't thank you both enough. I can't thank your departments enough, or the sheriff or his department, for being part of distributing Narcan, or being the first responder with Narcan. And Narcan, I think, has been a game changer. So Narcan is naloxone, and it reverses the effects of opioids in the human body. And if you're able to inject or squirt in the nose of somebody who is having an overdose, it can reverse that and essentially bring them back to life. And there are many opportunities for you to receive Narcan. You can get it at any pharmacy. You can get it from the Ross County Recovery and Outreach Center. They have a Facebook page, Ross County Recovery and Outreach Center, and also through Community Action, 702-72222. So Narcan has been the change in our community with the availability that's helped to decrease the number of overdose deaths. So thank you all so very much. This is a hard subject to talk about. It's a hard subject to constantly fight. And the person who is suffering from this fights the hardest. And they just want to get better, but it's a really hard step to take. Some from the stigma, some from the physical effects of that. But thank you all so very much. It takes a community to fight this. It takes a community to keep it up. So thank you so very much. And thank you for joining us today. I hope you found this session on substance use disorder very helpful. Be sure to follow us on Facebook and Instagram to get the most up-to-date information on COVID-19 and other important health topics. Be sure to join us next for our next Living Well with Adena on May 13th. Thank you so very much for joining us, and have a great day.